I'm Samir Kapadia. I'm a cardiologist. I'm chairman of cardiology at Cleveland Clinic in Cleveland, Ohio. So in 2016, the TAVR valve was approved for intermediate risk patients, and the WATCHMAN device was approved for patients who have atrial fibrillation to prevent bleeding or complications related to stroke. So the idea was that 40% of the patients who are undergoing TAVR have atrial fibrillation, and they are at high risk of bleeding, and they are at high risk of stroke. So the idea was that many of these patients would benefit from WATCHMAN device, and then all these old people have to come back again to the hospital and have the WATCHMAN device placed. So if there is a way to do the TAVR and WATCHMAN procedures together, then we prevent them from coming back to the hospital. And while we are doing one procedure, we can do the other procedure, and if we can do it safely or not. So the purpose of the trial was to say that if we can do TAVR and WATCHMAN procedures together, would we pay additional complication risk with this kind of combined approach? And if it will provide the benefits that normally WATCHMAN device would provide, which is an alternative to anticoagulation. So this was the idea of the trial. So WATCHMAN is a device that is placed in the left atrial appendage. The idea is that most of the strokes and most of the clots that happen in patients with atrial fibrillation happen because of the clot inside of the left atrial appendage. WATCHMAN device is a umbrella-shaped device which has clot on the surface of the device. So it prevents the clots from coming out of the appendage into the circulation. And it is anchored by small hooks which are on the WATCHMAN device, and we size it and place it inside of the left atrial appendage. So what we wanted to try was to have any patient who is undergoing commercial TAVR. So anybody who is going TAVI procedure, these are the patients that are included in the trial. They have to have atrial fibrillation. So if there is paroxysmal, continuous permanent atrial fibrillation, it doesn't matter. So any atrial fibrillation history, and they have to be able to take anticoagulation for 6 weeks. Because once you put the WATCHMAN device, you need to take anticoagulation for 6 weeks. So these are the patient population that we targeted this study. So the most important finding was that, first of all, when we did the procedure, combined procedure, we had to use more general anesthesia. So instead of 30%, almost all patients had general anesthesia. We took about 45 more minutes to do the procedure. And there was about 40 cc of extra dye used. However, the chance to have any major complications like bleeding, that, also the kidney problems were no different compared to single procedures. So if you need only TAVR versus TAVR plus WATCHMAN, the combined procedure did not add an additional risk. The only risk it added was that 4 patients had some pericardial effusion, meaning that some blood around the heart, and that they required just a needle aspiration of this pericardial fluid. So, and this is from the WATCHMAN device that was done. It's called WATCHMAN 2.5, the model number of the WATCHMAN. And now we have a newer WATCHMAN that does not cause this complication as frequently because it is safer to use, which is called WATCHMAN Flex. So right now the device that is available in the market is WATCHMAN Flex, because again, the trial took 2 years of follow-up. So the older device is so-called retired. So the most important take-home message is that if the patients are candidates for WATCHMAN device, meaning that if they're looking for alternative to anticoagulation because they are high risk of bleeding or whatever the other reasons are for not taking anticoagulation, if you are planning to do a WATCHMAN device, you can safely do it at the time of TAVR procedure. So this is a very important message because patients at that age, the families don't want to come back to the hospital. I also want to mention that the length of stay in the hospital was no different if you do combined procedure versus single procedure. So again, that tells you that you are able to do two procedures at one time without adding risk or substantial risk to the patient. The mortality was no different. Stroke rate was no different. There are two parts to the next step. One is to have a financial reimbursement for a combined procedure. So we will try that. In the United States, this is particularly more important. But that is one important thing, to provide some cost analysis to say that this is a cost-effective strategy. It makes sense, but still, we will try to address that issue. And the second, I think, more important part is that TAVR is one of the procedures where we can combine WATCHMAN device, but say, for example, the mitral clip or atrial fibrillation ablation. There are several other procedures that are done in the left atrium that you can combine this WATCHMAN procedure with. So it is just the beginning of the combined procedures, and we may be able to see more procedures that are combined in the future.